assessment on this patient, what we're doing today. So these lines bother you, right? The marionette lines down here. And I'm gonna just mark it out what I want to do for her today. So she really has deep marionette lines right here. I'm gonna place filler in this area just to kind of lift this up a little bit for her. I want to address all these little fine lip lines right here. We'll put some filler in here. And then one area that bothers her the most and that I see is her under eyes. So we're gonna put filler right in here, under her eyes. She did have Botox about 3 weeks ago. Raise your brows a little bit. See, she's looks super smooth here. Smile, yeah, Botox looks amazing. So that's what we're gonna address first today. Product, what I like to use, I love Velour for under eye, but she has really deep under eyes, so I'm also going to use Voluma, especially on the lateral side right here and right here. So I'm going to do a mixture of Velour and Voluma on her, but my favorite product is Velour for under eyes. And we're going to place it away from the eye, so very safe. We're going to go into this trough area, little boluses of product, and go all the way lateral as well. So it's very safe because we're not even close to the eye at all when we put the injections in. So for her marionette lines, the product that I love, we can do Voluma, you can use anything thick. You want a product that's very thick. So in her case, I will use Restylane Define. I've had great results because it moves with her face. So smile for me, lachte, and then relax. So Define really tends to do that really nicely. So it's thick. It's a product that you can lift this area. So does Voluma, so does Restylane lift, but there's many choices. It's what product do you like, what results have I had with what product. So I'm choosing Restylane Define for her today. We're gonna start with her under eyes. I love my little eye stick. It makes the patient really comfortable. I have them look up and then close their eyes. Very delicate injection, never put too much in, and you'll watch me doing it anyway, but just be careful with under eyes. It's very thin skin, so we don't want to ever put too much filler in that area. So I want you to look way up for a second. Schauen Sie nach oben und dann Augen zu. Is this okay for Sie?
Mm-hmm.
Yeah? This area definitely can bruise, so you have to warn your patients. Make sure they know under eye can bruise. Okay?
Mm-hmm.
It doesn't really hurt under the eyes because there's not a lot of nerve endings, so most patients are quite comfortable when injecting the under eyes. You will see little bubbles like this. That's why you don't want to put too much product. And it takes a few days for it to kind of settle in. I tell all my patients that. And look up for a second. Schauen Sie noch mal hoch. Okay, and then close your eyes. Machen Sie Augen zu. Okay, so halten Sie es ganz kurz fest. So on this patient, obviously, her first choice would be maybe to do surgery, but she's not going to do that. So the eye is going to look better, but they're not going to completely go away because we're looking at a fat back. So I'm going to really just try to camouflage this area to make it look better. It'll be softer, and the bags just won't be as pronounced. That's good?
Mm-hmm.
Okay. So this is Voluma, which is a little bit thicker, and I'm just trying to structure it a little bit lower on her eye area. She has thin skin, so again, you cannot put too much product on her.
it affect you the way you, the depth of your injection? If someone has thick skin or something.
Yeah. Well, Voluma, you always have to do a little bit. Are you okay?
Mm-hmm.
You inject a little bit deeper, which is what I'm doing now. But again, I'm not putting a lot of product in. And already it looks to me so much better than it did before, if you compare the sides. But yes, of course, ideally this patient would be great for surgical blepharoplasty. And you okay?
Mm-hmm.
You're such a good patient. Also, I have my patients come back 2 weeks later, and I kind of add a little bit more product. I never do it all in one go because you never want to overfill out under eyes. So when she comes back in 2 weeks, I'll notice, hey, let me put a couple more drops here or here, and then she has an even better result. But I let them wait about 2 weeks. Injectors will put a lot of filler for the under eyes, but I tend to be conservative because I just think it's a mistake. You can always add a little bit more, but too much product will make it look lumpy, and there's a lot of people who have to dissolve it and then add more, so my approach is more conservative. So now I'm gonna do this side, same thing, yeah? Alles gut? Alles gut. And then close your eyes. She has no discomfort, which is great. And the little bumps are normal because the product has to settle in, and that's another reason I like to do it in 2 visits. So much better. So much better already. Okay, relax, and then I want you to look up, high up to the ceiling. You have you hold it. Is that okay? Alles gut?
Mm-hmm.
Close your eyes. Again, I'm layering it now with a little bit of Voluma, which is just a thicker product. Because she needs that. And then look up for me, and then close. So when she comes back in 2 weeks, I'll probably add tiny amounts around the eyes just to finish it off.
So when you ask her to look up, what are you looking for?
So when I have her look up all the way, you can see the trough and see how she needs a drop right here. Mm-hmm. And if I didn't have her look up, I wouldn't know where to put the filler. Mm-hmm. Look up and then close. It's a very, very precise injection. That's why I don't like to use cannulas for this. It will settle down. She also has a little bit what's called malar edema right here. It's a little swelling. That's naturally her. I may put a little product down here just to camouflage that later. But in like a week, this is gonna look so good. So much better than when we started. Okay, a little bruise here that will go away. So you hold this for me, please, right here. Mm-hmm.